Do you want to help your patient quit smoking? Then you must first understand the challenge at hand. When we dive into the challenge of quitting smoking, we must acknowledge that it's not just about breaking a habit, it's about overcoming an addiction, and that's no small feat. The key culprit here is nicotine, a highly addictive substance found in cigarettes. It stimulates the release of dopamine in the brain, the feel-good neurotransmitter, leading to a sense of pleasure and reward. This makes the brain crave for more, and thus, a vicious cycle of addiction is born. But it's not just about the physical addiction. There's a psychological aspect too. Smoking becomes a part of a person's daily routine, a ritual of sorts, often associated with stress relief, socializing, or even just a coffee break. Breaking away from these associations can be as challenging as dealing with the withdrawal symptoms. And then, there are the withdrawal symptoms themselves. Irritability, anxiety, difficulty concentrating, increased appetite, and sleep disturbances are just a few of the hurdles a person might face when they decide to quit. These symptoms can start as early as a few hours after the last cigarette and can last for several weeks, making the journey to a smoke-free life a daunting one. This is where you, as healthcare professionals, play a pivotal role. You are not just the bearer of the stop smoking message, but the support system that can guide your patient through the storm. Your understanding, empathy, and encouragement can make all the difference in their quit journey. You can help them navigate the rough patches, manage withdrawal symptoms, and stay motivated when the going gets tough. It's important to remember that every patient's quit journey is unique, influenced by their personal circumstances, health status, and their relationship with smoking. So, the approach to help them quit should be personalized, flexible, and patient-centered. Understanding the challenge is the first step to helping your patient quit smoking. Remember, it's not just about stopping a harmful behavior, it's about empowering your patient to reclaim control over their life and health. And that's a mission worth taking on. Now that we understand the challenge, the next step is to assess your patient's readiness to quit smoking. This is crucial, as it allows us to tailor our approach to the individual patient, making the quitting process as effective as possible. Think of it as a journey, and we need to identify where our patient is on this journey. To do this, we can use a model known as the stages of change. This model breaks down the process into 5 stages: pre-contemplation, contemplation, preparation, action, and maintenance. In the pre-contemplation stage, the patient may not yet recognize that they have a problem. They might be oblivious to the negative impacts of their smoking, or they might be in denial. As healthcare professionals, we need to be gentle and patient, providing clear factual information about the effects of smoking. Next is the contemplation stage. The patient starts to acknowledge the problem, weighing the pros and cons of quitting. They may start to consider making a change, but they're not quite ready yet. Here we can help by discussing the benefits of quitting and addressing any concerns they might have. The preparation stage is when the patient is ready to quit and begins making plans. They might set a quit date or start reducing their smoking. Our role here is to guide and provide resources to help them prepare for the journey ahead. In the action stage, the patient has started the process of quitting. They're actively taking steps to change their behavior. We can provide support, encourage them, and help them manage any withdrawal symptoms. Finally, in the maintenance stage, the patient has quit smoking but needs to maintain their new behavior to avoid relapse. We can provide ongoing support, celebrate their success, and help them deal with any cravings. Each patient will progress through these stages at their own pace. It's not a linear process, and sometimes there might be setbacks, but by understanding where they are in their journey, we can provide the right support at the right time. Assessing readiness is key to tailoring your approach. Remember, every patient is unique, and their journey to quitting smoking will be too. With an understanding of your patient's readiness to quit, it's time to approach the discussion. When it comes to initiating the conversation about quitting smoking, it's essential to be strategic. This is not a discussion to be rushed into, but rather a dialogue that requires careful planning and thoughtful consideration. Remember, this is a delicate topic, and you're aiming to encourage a significant lifestyle change. Creating a safe and supportive environment is paramount. This involves fostering an atmosphere of trust and openness, where your patient feels comfortable sharing their thoughts, fears, and concerns. This can be achieved by maintaining a non-judgmental stance, showing genuine empathy, and actively listening to what the patient has to say. Motivational interviewing techniques can be incredibly useful in this context. These techniques involve guiding the patient to discover their own motivations for quitting smoking, rather than imposing your own reasons. Ask open-ended questions, express empathy, and reflect back on what they're saying. This encourages the patient to explore their own reasons for wanting to change and helps them to feel more invested in the process. Avoiding judgment or pressure is crucial. Remember, your role is to support and facilitate, not to dictate or condemn. Even if you're frustrated or concerned, it's important to remain patient and understanding. Negative pressure or judgment can often lead to resistance and defensiveness, which is counterproductive. Instead, focus on positive reinforcement and validation, reinforcing the patient's own reasons for wanting to quit. Keep in mind that each patient is unique and what works for one may not work for another. By taking the time to truly understand your patient's motivations, fears, and concerns, you can tailor your approach to best suit their needs. Remember, the goal is to create a partnership with your patient, where you're working together towards a shared goal. This approach encourages a sense of autonomy and empowerment in the patient, which can greatly enhance their motivation and commitment to quit smoking. Approaching the discussion with care and understanding can make all the difference. Once you've initiated the conversation, the next step is offering support and resources. There's a plethora of tools available to help patients quit smoking, and it's our job as healthcare professionals to guide them towards the ones that best suit their needs and preferences. Firstly, let's consider nicotine replacement therapies. These come in various forms like patches, gum, lozenges, inhalers, and nasal spray. They work by providing a controlled amount of nicotine to the body, which can help to reduce withdrawal symptoms and cravings. Next, we have prescription medications. Drugs such as Chantix and Zebin can be effective in helping to curb cravings and withdrawal symptoms. However, they're not for everyone and should be used under the supervision of a healthcare professional due to potential side effects. Counseling is another potent tool in our arsenal. Whether it's individual, group, or telephone counseling, this approach provides patients with ways to handle stress and other triggers, and helps them develop a personalized quit plan. Remember, quitting smoking is not just a physical challenge, but a psychological one as well. Support groups, online communities, and quit lines can also offer invaluable support. They provide a platform for individuals to share their experiences, challenges, and successes, creating a sense of camaraderie and understanding, which can be a powerful motivator. There are also mobile apps that track progress, provide tips and encouragement, and even offer hypnosis sessions. Technology has certainly broadened the scope of resources we can recommend to our patients. Now, while we've discussed a range of resources, the key point to remember is that every patient is different. Some might find success with a combination of nicotine replacement therapy and counseling, while others might prefer medication and a support group. We need to tailor our recommendations based on the individual patient's needs, readiness, and preferences. Offering the right support and resources can empower your patient to take the next step. By presenting a variety of options and working together to create a personalized quit plan, we can help our patients take control of their health and start their journey towards a smoke-free life. The final step in helping your patient quit smoking is follow-up and encouragement. The journey to quit smoking is filled with numerous hurdles, and it's important that the patient doesn't feel alone in this process. This is where the power of regular follow-ups comes into play. Just as you wouldn't leave a patient with a chronic condition without periodic checkups, the same applies to those trying to quit smoking. These follow-up appointments provide an opportunity to monitor the patient's progress, identify any challenges they may be facing, and adjust the treatment plan as needed. It's a chance to reassess the situation and make changes in real time. Remember, quitting smoking is not a one-size-fits-all journey. It requires a personalized approach that adapts to the patient's needs and circumstances. But follow-ups are not just about tracking progress or tweaking the plan, they're also about maintaining motivation. This is where encouragement plays a crucial role. Positive reinforcement is a powerful motivator. A simple "well done" or "you're doing great" can go a long way in boosting the patient's morale. Celebrate their small wins. Each cigarette not smoked is a step closer to a healthier life. Show them that you recognize their efforts and that you're proud of their progress. Encourage them to keep going, even when the going gets tough. And remember, encouragement isn't only for the times when they're doing well, it's equally important when they stumble. If a patient has a relapse, it's crucial to remind them that it's just a setback, not a failure. Reaffirm their ability to quit and reassess the plan to better handle similar situations in the future. Encouragement fosters resilience, and resilience, in turn, fuels the journey towards a smoke-free life. Through follow-up and encouragement, you can help your patient stay on track and ultimately achieve their goal of quitting smoking. And there you have it. The journey of quitting smoking is a challenging one, but with understanding, readiness, the right approach, support, and regular follow-ups filled with encouragement, you can guide your patient towards a healthier, smoke-free life.